Welcome to Starkey Sound Bites. I'm your host, Dave Fabry. Now, before we dive in, please hit like on this episode and subscribe if you've listened to past episodes. That can help us spread our message of better hearing and helping people and professionals connect better and raise awareness for the importance of hearing as a health condition. So, May is Better Hearing Month, and we wanted to take the opportunity to shine a light on the hearing care professional and people who are helping those with hearing loss each and every day. Yeah. And so joining me today is somebody that I've known for a long time, actually, but it's been a minute since you've been on the Starkey campus. Dr. Zack Miller, welcome to the podcast today. Zack is a private practice owner who purchased Midwest Hearing a bit ago.
It was the beginning of 25.
25, so it's been a bit, about a year or so.
Yeah, just starting my second year.
And so you have multiple practices, multiple locations rather, throughout Kansas. Just in Kansas?
Just Kansas, 31 locations in Kansas.
Yeah, that's a couple.
And
so
they're spread out throughout the state, and most people, most of the employees have been there for 20 plus years, so they're pretty self-sufficient. So I got a great team. So that's what I've just been almost like a family business for a while. But even though we're not related, we still consider ourselves, a small family. So
and I can, even though Starkey has over 5,000 employees globally, we're kind of a family-run business too, privately held, not publicly traded. So our loyalties are the hearing care professional and ultimately to the patient, but also it feels like a family. So some of us had an extended family more than others, but 31 locations is impressive. And I really do want to do a little bit of a deeper dive into issues facing business owners, practice owners, and everyone from someone who's got one location to thinking aspirationally, those who are thinking big of one day having 31 practices. But before we begin, we're gonna take a deep dive today into private practice and practice owners and business owners, and it's a challenging time to be a business owner today. But before we dive into that, talk a little bit about what drew you to audiology. I love hearing origin stories as to what was the catalyst that caused somebody to choose this as an occupation.
So it wasn't a plan of mine initially. I grew up in Southeast Kansas. My parents have been and still are hearing aid dispensers, hearing instrument specialists, and they've been doing it for 35 and 40 years. Out of high school, I went to Pittsburgh State University. My plan was go in pre-med. I took my second chemistry class, and I was like, this isn't for me. And then Terry Brewster, the owner of Midwest Hearing Aids at the time, he was wanting a doctor of audiology on his staff. And so I transferred then to Wichita State because they had I was the second class, I think, in their AUD program. So, and then it just went from there. 2009, I graduated with the AUD and started with Midwest Hearing Aids after that and been here ever since. I have never gone to work like ever hating my job. Like, I love going to work every day and love what I do. So
think about how rare that is. I mean, it took me until I was probably 40 years old before I realized that most people go to work thinking about the weekend, to quote the old lover boy or whatever. And everyone's working for the weekend. But I have this, and I'm a lot older than you, but I wake up every day. Some days, sure, you're tired or whatever. I mean, but every day I'm kind of excited to get into the office or wherever my office is that day, and that's rare. So
I know it's. I tell my wife that all the time. It's like, I love going to work. I mean, you're going to see different people every day, and then that's one of the things when I purchased it. I still wanted to be able. I didn't want to sit at the desk and do all of the business owner things. I wanted to still see people work with people. That's where my passion is. Love to help people, not just hearing, with charity, things. We have a small charity that we run in Kansas. And I just enjoy that. If you don't like or love to help people, and you're in this industry, you probably shouldn't be.
Exactly.
So,
I think that is the central component that drives all of us, whether you're working on our end where, the needs of that patient are central to when we're developing technology. And I believe, like you do, that being a player coach is essential. It's the thing that keeps my saw sharp, is that in addition to participating on the R&D team and helping to offer input into the next generation of technology, I still see patients because it's really easy to become intoxicated by the technology that surrounds us. But there's nothing that levels the playing field better than sitting across from a patient and getting their opinions and hearing their responses to how that technology is working to have an impact on their life.
Yeah, and it's you never stop learning. Like, it's like when you're seeing a patient, like for a follow-up, or mainly that's where you really dive into some issues they may be having. And I was like, just explain it in your own words. Like, maybe I'll learn something too.
Yeah.
For the next person that may come in and have similar struggles that you're having, if you're having any. The hearing aids are much easier to fit now than they used to be because it's just easier to adapt. Especially even from the Starkey's Livio product to the Omega, it's night and day.
Night and day. And that's really just, 8 years difference and a world of difference. And really,
I've never seen anything like it.
Yeah.
Well,
thank you.
It's fantastic. And I don't just say that.
No, I know. You're a straight shooter.
Yeah.
And, you brought up Terry Brewster, and somebody that I knew very well, and I still think of him from time to time. Every time I see a Coors Light, I think of Terry Brewster. And
we had a couple of those last night for him.
And just a remarkable mentor. I think to have worked directly for him. He was a mentor to me, just informally, as I think he was for a lot of people.
I met Terry. Well, Terry hired my dad in 1989. And because he played slow pitch softball with Terry, and I was the 5-year-old that had to go fill up everybody's beers, So it started from there, and then.
Well, look where you are now. So let's for our listeners who are predominantly audiologists and hearing instrument specialists. Let's talk a little bit about your journey then, from somebody that started out working in the practice and now you're the boss. And, what's harder than you expected about owning a practice, and what's easier?
I have such a good team, and, it's surrounding yourself with good people, that you can trust. That's really what going to make you a successful business owner, I think, so far. I got a lot to learn, but I'm coachable. So
you're listening to your team. In addition, you're not just telling; you're listening.
No, yes, I'm not a teller. I give my opinion, but when we come up for things like this, like at Starkey, everybody can learn from everybody else. I think we have over 430 years total experience on our staff. You can always find out different things, like different tips on, certain fitting issues, things like that. And everybody puts their heads together, and that's when we make strides and move forward. People get better at fittings. They get better communicating with patients in different ways. So you're always learning. If you're not always learning, then
something wrong.
Yep.
Yeah, you're not listening.
You
can hear. I would say with patients, I can help you hear, but I can't help you listen. And I like it so much. I have a tattoo: 2 ears, 1 mouth. Because I don't learn anything when I'm talking.
Right.
I learn a lot more by listening. And sometimes the newest members of your team can, they say out of the mouth of babes in many cases, but sometimes the new members, a friend of mine, Mike Maddock, talks about you can't read the label when you're inside the jar. And anytime you've been with the practice for more than a year, you're inside the jar and you don't see with that same beginner's eyes. And so I lean into newcomers, to Starkey or newcomers in partners, people like yourself that are partnering with us, because they give us sometimes the most valuable insights because they're outside the jar.
Yeah, outside looking in.
So what's easier about this? Relying on the team? Is that what you'd say?
I don't know what would be easy about it. They make it easier. For sure. Yeah. And, I had after Terry Brewster passed away, Chris Spencer bought the practice. I learned, and I owed a big thanks to him. He's really what made this happen and made it possible. He wanted to keep the Midwest Hearing Aids culture. He knew if somebody else bought it or he was bought out by, a bigger entity, the employees would be in trouble.
Right.
They wouldn't. It's just Kansas is a different animal.
Yeah.
Our patient relationships are what make us successful. We have very close relationships with our patients. Like last year, my dad was even a pallbearer at one of our patients' funerals. That was pretty cool.
Yeah.
Just that they trust you.
Boy, I'll say.
Yeah, it's existing patients are our biggest business.
Well, and to that, then let's follow up on that just a bit and say, what's one thing that you think that Midwest Hearing stands for and that you endorse that cannot be commoditized? We all worry about what we're doing being commoditized. There's threats from everywhere, from over-the-counter hearing aids, or, low-cost competitor or something like that, someone who's got a different focus. But what's one thing that you would say characterizes Midwest Hearing and something that cannot be commoditized?
Patient service.
Yeah.
That's it.
Yeah.
You don't survive unless, especially most of our locations are in small towns. We're talking 8,000-9,000 people, something like that. You're not going to last.
Right.
If you don't treat people the right way.
Right. And to that end, then if a patient comes in and tested not sold, and walks out because let's say they're kicking tires, they're price shopping.
Yeah.
And what do you do? Does that happen ever? I mean, in some of these smaller towns, you guys probably are the dominant name so that you have that authority. But in those areas where you do get tire kickers, and they walk out, what do you do to win them back? Do you wait for them, or do you follow up?
I'll follow up with them. Usually, I'll follow up. I'll give them a week or so, depending on the read I get on them when they're in there. But following up and just treating. You can get a read on a patient, and just know if they're going to be back or
they're not ready,
or they're not ready.
Maybe they're using price as that first objection, but they're really not ready, and you kind of
And
learn.
And I'll just tell them that I'm like, I'm not going to try to talk you in to a trial. I will explain what you will be missing in the future, possibly, and what it can lead to, untreated hearing loss, Well,
I think it really is understanding and really leaning in, listening and observing that patient. Is it really about price?
Right.
Is it because they're not ready? And I think sometimes you build trust by allowing instead of focusing, so many people focus in a practice on tested, not sold, and they try to reduce that number as much as possible. But I think in some cases you do better if you really recognize from your experience, and you have, like you said, trusted staff that recognize when a patient truly isn't ready, and you tell them that, come back when you're ready.
Yeah. Right.
That may be the best recruiting tool for bringing them back.
I totally agree with that. I mean, and they appreciate that too, because they don't want to be pushed.
Well, and a lot of, like you said, a lot of these towns are smaller. People talk to each other.
Yeah.
And they don't want a high pressure sale. I mean, in the sense, but you're always by being honest with them and just calling them out on saying, just come back and see me when you're ready.
Right.
You're showing to them that you care about where they are in their journey.
Right. And the saying around there, a lot of times it may be everywhere, is like, you know, if they have a good thing, they'll tell one person. If they have a bad experience, they're going to tell everybody.
And I would say, I would add a corollary to that, because you mentioned, and thank you for your partnership, but you mentioned the difference between Livio to now Omega AI, and the way that technology has been improving. That the issue is today, the technology is capable of accomplishing remarkable things, but it still is ultimately that caring. It still doesn't fit itself,
right?
And you know, and I think the caring that of the professional to understand and recognize what is particularly for first-time users, what are their concerns? What are they? So many times just shutting up and listening to, especially if they have a family member come with them. Is that a standard of care in your, typically do you advise if they have a family member to come along with them?
Absolutely.
What's the advantage of that?
Well, so many times patients will come in and they don't think they have a hearing loss. You know, they're in there. If they come by themselves, they're forced in by their spouse, but then the spouse or third party doesn't come in. And so they basically, I mean, how many times have you tested it and they're like, okay, I'll just go show this to my wife. Like, they're not saying anything.
Right.
Regardless.
Right. Never. Yeah.
They're just going to be like, I'm fine. He said I was fine.
Yeah. Or there's nothing I could do right now, or nothing that needed to be done right now. But when you have that family member there, number one, you can observe, where are they? You know, is it the family member that's bringing them in, got them by the ear, literally, almost, or figuratively, or maybe even literally bringing them in, or where are they? And I think so much can be gleaned by having a family member or a colleague or close friend come in with them to talk a little bit about their experience, and then just watching those two interact really helps a lot. And, and then also doesn't give them that out to say, well, I got to talk to my husband or I got to talk to my wife.
Right. And you know,
there.
Sometimes, you know, especially if the patient themselves isn't saying much, but the spouse is, sometimes you almost end up, and I try not to, but you almost end up focusing on the spouse. But you know, you got to. It's both though. I always tell patients that the hearing aids aren't just for you. Yeah, they're for the people that you communicate with the most and care about the most and talk to every day. So.
Well, so you talk about the fact that from a standpoint of best practice, and best practice is a popular topic among private practitioners, and everyone's dealing with sort of combining best practice with the need for innovation and looking at things a little differently. So you talk about, you know, advising, recommending that if they bring in a significant other to that initial consultation, that's a part of encourage practice. Yeah. When you get down to the nuts and bolts of testing that you're doing and things like that, where do you refuse to cut corners clinically, even if it takes more time or, you know, costs in terms of revenue? Is there anything that is such a central part of your culture or your core that you won't cut corners because you find that although it may impact and takes a little longer, or it may even have a revenue hit, that you find that it's part of that culture that's built into Midwest Hearing? You know, it's you spend time, take your time. Yeah. You know, they're not just a number. Yeah. You know, they're your patients. They're ending up, treat them like your family members, like you would your family. And that's where you don't cut corners. Yeah. Like you focus on the patient and give them your time. Don't try to theoretically run them through like cattle. You know, get to know them. You know, you're going to have the most success that way. They're going to feel comfortable saying what they need to say, how they need to say it. And you just establish that rapport with them, and then that's what leads to success, and that's what leads to confidence. You know, being confident about what you're doing and what you're dispensing is 95% of it. You know, it's I don't know where I got that number, but you know, you know what I'm saying. Yeah, but it's and eating more, especially, you know, with Starkey and the Omega AI. It makes our job so much easier. It's a smoother sounding hearing aid.
It's not as harsh for the, with those steep sloping losses. It's easier to get used to. It's a quiet hearing aid. I hear that all the time, especially from existing patients. Like, this thing's quiet. You need to turn it up. I'm like, let's give it a minute. Time.
Yeah,
let's see how the clarity is, and they love it.
Is there a favorite feature of Omega AI that you find, either something that it's built in, like a feature like the DNN 360, or something within the app that the patient is using that you find is really resonates with patients or clinicians?
The Edge Mode Plus in noisy environments especially, that's where I noticed it, like restaurants. You go to Edge Mode and you have three choices there. But that's the 24 technology is, I've talked with some other, they're not colleagues, but other dispensers in Kansas, and some of them, they're not doing the 24 technology very much. And I talked to them a couple weeks ago. It's like, you're missing the boat. Like, there's a big difference between that 16 technology and the 24, especially with the spatial awareness and the DNN 360.
The DNN 360, where patients that I'm working with will say they hear more, but they are hearing more clearly.
Right.
Even though they're hearing more of that spatial all around, that gives them that confidence, that localization, and that awareness of sound. Not only that the sound is present, but where it's located.
Right.
That's very different than anything they've worn previously.
Yeah. It's just it's a clearer sound. I was talking with the team earlier in the earlier session this morning with Aaron, and even patients that have struggled in the past that haven't, the Omega was the second hearing aid they tried for this certain patient, and their recruitment is really bad. And they started with the Livio, and then she kept it, and I don't know how many follow-ups I did with her. I was like probably close to 30.
Wow.
And she just could not wear it. And then she came in and tried the Omega, and she was able to tolerate it. Although she was on her crowd setting with the Edge Mode reduced noise the whole time.
The Edge Mode reduced noise. So really, and I think that's. Let me put a pin in that. I want to come back to that because, let's address that first. Like, one thing that I'm finding, and I'm curious whether you're finding this, is that using the personal all-around program, for those unfamiliar with our technology, that's the all-around setting that people wear the majority of the time, but then often people will program manual programs that they can use situationally.
Yes.
But what I've found lately and again, I'm a big believer in the 24 technology, not just because it's higher technology tier, because that top tier, it's better, and that ability to have those patients have not only the DNN 360, but then to have the 3 different levels of Edge Mode to be able to enhance clarity or improve comfort.
Right.
I'm migrating away from manual programs to using personal plus Edge Mode for those patients who can handle it. And I'm astonished at how many patients that you might think, this 80-year-old, they're not going to use the app. Well, you can do it just on the hearing aids. But many now, many more than what we thought previously. Maybe as my birthdays get more and more numbered, I take this a little defensively. But the 80-year-olds can handle using the app with personal plus Edge Mode, and even those that can handle using the different Edge Mode of the 3 settings in lieu of using manual programs. Are you seeing that at all?
Yeah. We talked about that this morning too.
You did?
And, I actually brought that up. I was like, I've had more patients that I've programmed, just left it on personal. That's all I gave them. A lot of times they don't even use Edge Mode.
So it's personal.
It's just personal, and they just let it go. But that, don't, like, when somebody comes in and they're like, I don't want to mess with the phone. I was like, I don't want to hook that up to my hearing aids. I was like, well, let's just try it. Actually, a lot of times I don't even bring it up at the initial fitting. I mean, I tell them about it and the feature is there, but I said, let's concentrate on hearing better first. Some people get so wrapped up in the app that they forget why they got the hearing aids in the first place.
Right.
But so then you just start simple, I mean, those people that, oh, I'm never going to use my phone, I don't look at it. They come in, 6 months later, and they're out in the waiting room watching YouTube on their phone.
I know. I see it all the time. I love that. That warms my heart.
Yeah. It's cool though. I mean, because then that's a game changer.
Yeah.
Really
Once you open it up to streaming, and then they realize what the world opens to them for, not only for phone calls, but YouTube videos and audiobooks and everything else, and they're hearing it. Program for their boss.
And I'm not trying to downplay the phone. It's essential in my opinion. But they don't know what they're missing when
baby steps. You start with baby steps, like you said. Meet them where they are, and then take them where they can go. Yeah. And you just gave me, I'll have to talk to Karen Spaeth and our marketing colleagues, because I think Omega AI, it's personal. It'd be a good tagline, because you just said it eloquently.
We're taking it personal.
Yeah. We say you don't hear with your ears, you hear with your brain.
Right.
And we're often still fitting the peripheral loss. But that's one of the things that Achin Bhowmick, our CTO, has been very clear on is, we're really thinking about binaural fittings. I mean, our technology has been optimized for the input coming from both ears, and particularly that DNN 360. It can be fit for one-sided losses, but it's optimized to think about not only the peripheral loss, but what goes on when you get to those higher pathways. And those are really the challenging patients. And I guarantee you that when... Going back to the original comment about when someone's happy, they tell their family. When they're unhappy, they tell the town. I would say that the newer technology, when you have a patient who's delighted with your service and our technology, they'll tell a lot more people.
Right.
And when you convert those, you stay on top of always trying to, I've got a couple patients that I work with. They're the ones that are the really tough ones to bring around.
Yeah.
If you convert them, they become your biggest advocates.
Oh, yeah.
So you talked about the difference from Livio AI to Omega AI and the remarkable improvements in the technology in your hands and to best meet the needs of the patient.
Right.
Do you see in Kansas, in these 31 practices, is there AI fatigue, that we're all overwhelmed a little bit by AI? My toothbrush has AI in it. And, how do you separate the technology from what your role in marrying that technology to meet the need of the patient?
And, sometimes you'll have those paranoid patients about AI, and they're scared of it. And, so they don't know there's AI in it sometimes,
and I don't think they need to. They don't
really
care
need
necessarily.
To. It's different than a hearing aid AI is different than, a Perplexity or a Chat GPT.
Yeah.
They're not the same, obviously. So, but it freaks some of them out, and the change scares them, and so we just stay calm with it. Don't worry about it. It's not tracking your every move. It's just like when you pull up data log in a follow up, they're like, wait, you're tracking. You see where I go? Yeah, it's a live 360 hearing aid. No, it's DNN 360.
Yes. But we're not tracking what you're saying, where you're going. We're not following you. And as a medical product, we don't do that. But the data logging is just helping you. Do you use data logging in follow-up appointments to sort of drive and personalize? What features are you looking at within the data logging that are most essential, if you will?
Number one, wear time.
Yeah. And what are you seeing now for average wear time in your patients?
Probably anywhere from 8 to 12 hours.
Yeah. I think it's been creeping up.
It has. It has. They're just easier to wear.
Yeah.
They're not.
And like you said, they're quiet.
Yeah. They're not as harsh. Like the high frequencies aren't. You don't have people saying, "Oh, it's way too tinny." I'm hearing that less and less now. But they're still getting the clarity without that. You're going to have those, normal hearing, then at 3K they drop down to 70, and those are hard patients to fit, especially in the past. But they're easier to fit now.
Yeah.
They can adjust and adapt to it a little quicker, and they have better luck with it. Yeah. So,
do you scroll down to what I would call page 2, like in the old Google searches? Page 2 of the data logging, which is down in the lower left-hand corner, where it shows the environments, the percentage of time that they're in the different environments.
All the time.
How does that shape conversations that you have with patients?
I mean, it depends on what they come in and the issues they may have. I've been having trouble at work, or with understanding clarity or understanding speech and noise. And you look down there and like, well, they've been in speech and noise 30% of the time, quiet, never. And then you'll have some people that come in there and quiet 80% of the time.
Right. Just lifestyle.
And you want to see like, hey, how many times is it switching to directional?
Yeah.
And you can see the percentages there. It just helps me as a clinician figure out what's helping them and what features they're using or not too, and what we could do to improve upon it.
Yeah.
So
excellent. So coming down to just a couple rapid fire questions, and then we ran out of time, and this has been a great discussion.
Yeah.
And it flew by.
It did. I enjoy it.
Yeah. One thing you'd fix in our profession overnight, if you could, if you just had a magic wand, what's one thing you would fix about the discipline or the practice for an audiologist or dispenser?
The thing I would like to fix, when I have some people patients that come in, they've tried hearing aids before, they won't get what they need because of the previous experience they had, and it put a sour taste in their mouth. So having more audiologists and hearing instrument specialists that care.
Yeah.
There's a big difference. Like when you don't relate, and not to beat a dead horse here, but when you don't relate to the patient, and then it's a detriment to that patient the rest of their life, because they won't. I mean, sometimes they'll come around, but if not, they'll end up just settling for a lesser technology than what they really need because of the programming issues that were done previously.
Yeah. I think that's such an important point. I mean, because we talk about meeting the patient where they are, but words matter. And when a patient can lock into just a part of what you think you're trying to convey to them about they're not ready for amplification or their hearing loss isn't severe a lot, but a lot of times you're undoing a past negative experience, because people say, oh, well, hearing aids won't help your hearing loss. And they hear, well, hearing aids will never help your hearing loss.
Yeah.
Or some other statement that we kind of throw off that the patient focuses on, especially if they're sort of ambivalent as a new user about whether they don't like that they have a hearing loss, they're not wild about thinking about hearing aids. And if now someone has said, okay, well, hearing aids aren't going to help you, they'll hear that and stick with it. And yeah, that would be one thing, is not just to throw off some of those quick statements if you've come to the end with a patient that you haven't figured out the solution to their problem.
I've seen that a lot. Like I had a patient, he's been my patient for 10 years, but when he first came in, where he got his previous hearing aid, said, you don't need one for the other side.
Oh, yeah.
I mean, his word rec was poor, but he still had usable hearing in that ear. And when he got that second one, when he got the set from me, I was like, just try it. If you don't think it's gonna work, then we'll figure that out. And he loved it, and he's hasn't left ever since, and he's on his second set now.
Fantastic.
And he loves it. He comes in. He's one of my buddies, and we just come in. And there's a lot of BS that goes on sometimes with some of these people.
It's not BS. It's just relationship building.
Talking BS. Come in. Sometimes that's all they have to do. Certain people have to do. So they just want to go in and have a good laugh and have fun. And
it may be for some of these patients, may be the best socialization of that week.
Yeah.
They come in.
Oh, yeah.
There have been times where I'm like, well, is there anything we need to do? No, hearing aids are working great.
Yeah.
And I'm thinking, why are you here? But they're here because they enjoy visiting with you.
Yeah. If I have the chance to have fun while we also help them hear better, sign me up. I'm all in every day.
Back again to why you're excited to go into work every day.
Yeah.
So last question then. 5 years from now, what will separate thriving practices from those that are struggling? You're a year into the ownership, but you've been a lot longer. You're steeped in this business. But 5 years from now, what would you say is going to be one defining thing that will separate the haves from the have-nots?
Man, it's just, I hate to go back to it, but it's patient care.
Yeah.
Like the people that will treat their patients right and try to relate to them and listen, like you've been saying. That's what's going to separate people. That's what will separate Midwest hearing aids from everybody else too.
Yeah.
I mean, one of the slogans we use is, Midwest hearing aids. There is a difference. There is a difference. There's a difference in coming to us as opposed to possibly some big box stores or other practices. But you got to make that difference,
right?
And you make that difference by relating with the patient and serving them how you would want to be served yourself.
Yeah.
So
it's so well said. And with Starkey, we believe very strongly in the prescriptive model of care because we believe at our core that our technology in the professional's hands delivers optimal results.
And just to, I think coming to I went to the CEO Summit, and I've never seen the culture of Starkey be any better. Like it's
wow. Thank you.
It's
that's a strong statement.
I mean, I've been around for 16 years or so, but it's a different feel now when you go to the business summit and things like that. And I don't beat around the bush. I know you don't. I really mean that. And
we'll leave it there because that's the strongest compliment you can give. Because I think it's because we now have absolutely leading technology, but we have a great team. Both our team at Starkey, but also our providers,
and that shows, and that rubs off too when you come to these like the business summits and CEO circles and things like that. It's contagious.
Can't say it any better myself. So, Zach, thank you very much for this conversation today. It was really great.
Thanks for having me. It's an honor. Appreciate it.
Tune in for the next episode, and I hope you enjoyed this as much as I did. Thanks so much, and keep listening.